Dementia is a huge thing in our society. It is another hot topic in healthcare. It is something that a huge percentage of our population is dealing with, whether themselves, whether a father, a mother, a grandmother, a grandfather, a cousin, an uncle, you name it. We all have someone we know who suffers from some form of dementia. Alzheimer's, Parkinson's type, vascular dementia, you name it. We all have come in contact with dementia. So the real question is, when do I identify my loved one with dementia as hospice appropriate? The best way I can describe that is look at how often they're sleeping, how much they're eating, how much they're interacting socially with others, how many words they're able to speak, and how much assistance they need with their activities of daily living, feeding, dressing, toileting, etc., etc. Dementia is a progressive disease. As you get in the later stages of dementia, you're going to sleep longer, 10, 12, 14, 16 hours per day. You're going to eat less. You're going to eat 30, 40, 20% of your meals. You're not going to be able to communicate. The language becomes nonsensical, and then it becomes non-existent. At that point, then you stop being able to ambulate and walk. Then you become in a wheelchair. Then pretty soon you can't even sit up in a wheelchair. If you are seeing these things occur and your loved one is declining, whether rapidly or slowly, it's time to talk to someone from a hospice agency. Have them come out, do an evaluation. Have them have a face-to-face encounter. It's never too early to have that resource in your back pocket for when you need it. Because the last thing you want to do, as I've said over and over, is wait till the final hours and days to ask for the resource of a hospice agency. They're ready and willing to come out and help your loved ones. And dementia is a very real disease, and it's a very difficult thing for people to cope with, recognize, and understand the process of what is just an infection versus what is natural decline. And that is something that's very difficult for people to recognize. I encourage everyone to read about it, study it, talk to professionals about it, but hospice is a key component of that end of life with dementia patients.